What's going on, guys? Tony here. In this video, I want to share a little tip to help you improve the quality of your documentation. Now, I'm going to be talking specifically Medicare related documentation, but this would apply to most payers. There's a couple of things I want to preface this with. So first, there are components of the medical record that can be copied and pasted. You need to understand which components those are. There are components of the medical record that must be original every single time. So for example, information specific to the case, specific to the patient, past medical history, medication list, what happened, what makes it better, what makes it worse. Like, these are things that always need to be original. They cannot be copy and paste. But there are certain components that, if we're talking about a plan of care that includes therapeutic exercise and what therapeutic exercise involves and the CPT code, like some of that obviously is copy and paste. And then if you're going to be using, which you are required to use, some sort of functional outcome measure or some sort of functional determination of prior level of function, current level of function, goal level of function, I want to show you a little strategy that you can use that should help save you some time and improve the quality of your documentation. So behind me on the screen, I've got a blank Google Doc document. And what I'm going to do is I'm going to start building a little bit of a template using this document. Now, according to Medicare Guidelines, I'm going to scroll up here. We want to understand, this is from CMS Chapter 15, Section 220. We want to understand the requirements for a treatment note, also known as a daily note. The requirements are the date of the treatment, identification of the specific interventions and modalities being provided, and most important, total time code treatment minutes. So in other words, how many total minutes of therapeutic exercise? How many total minutes of manual therapy? And total treatment time in minutes. So the patient treatment time might have been 67 minutes. 24 of those minutes might have been manual therapy. 38 of those minutes might have been therapeutic exercise. A couple odds and ends that might be in there that are non-billable minutes. But the idea is they're telling you quite specifically, we need clear determination of the total timed code minutes and the total treatment time in minutes. We need a signature and professional identification for the therapist who delivered the service. And if there's a supervising therapist for an assistant, that needs to be noted. If the treatment is added or changed under the direction of the clinician is the PT, OT, that information needs to be included. And then additional information that is optional, it is recommended. Treatment may also include, but it isn't required. In this part, I'm going to stick to what's actually required. So that's a brief overview of what's required for the treatment note. And then, of course, we have requirements for the progress report, which I'm scrolling past right here. If you're going to combine your treatment notes and progress reports, that's fine, as long as the treatment note includes what's required in the progress report. But what I want to talk about is specific to the functional reporting. Now, I'm not talking about reporting on the claim. I'm talking about documenting functional assessment for the individual, including scores, including progress of function, measurable progress, objective measurable progress toward identified goals. So let me show you kind of the easiest way I've found to make this work. You want to find whatever your functional outcome measure of choice is. So I'm going to go with a back index. Actually, you know what? I'm going to go with a lower extremity functional scale. I like this. I'm not a big fan of the back index, although I use it. What I'm going to do is I'm going to come in here. And basically what we're going to do, whether you use this form in its entirety or you pull out parts of the form, A form like this could be appropriate for many conditions, right? This could be appropriate for obviously a knee replacement, a hip replacement, difficulty walking, sciatica that's affecting lower extremity, gait, balance, neuro conditions, Parkinson's. Like, there are so many things that this would apply to. But simply put, what I want to do is I want to look at kind of I'm going to look at walking 2 blocks. So on my list here, I'm going to choose walking 2 blocks. And what I'm going to do is I'm going to say current level of function. I'm going to highlight this, and there's a couple ways you can do it. Not currently, apologies. Current level of function. Goal level of function. Prior level of function, right? And according to this, what are going to be my options? Now I've got, let me see if I can just copy paste. I'm going to copy that. I'm going to bring it over here. I'm going to paste it without the formatting. I'm going to make it into 1 sentence. Hopefully you guys kind of see where I'm going with this. This is the legwork of building a business. Now, are you the one that has to do this? Certainly not. You can pay an administrative assistant to do this. You can pay a PT, OT student to do this. You can have a virtual assistant do this, right? If you can explain to them what it is exactly that you're looking for, you absolutely can have this done. What I'm going to do is I'm going to drop that up there. And then I'm going to clean that up. What I would do is I would literally go through and choose all of these, right? So walking between rooms, I'm going to drop that in 3 times. I'm going to grab this, and what I'm going to actually do is, because I'm going to be using this multiple times, actually, I'm going to show you something. You can see I haven't done this for quite a while, so I'm a little rusty. Okay, so what I could do is copy that, drop it here, copy this, paste, paste, paste. Make sense? Let's pick one more. Let's talk about rolling over in bed. That's fine. Let's grab that one. Okay, so what I'm going to do is I'm going to grab my 3 levels. I'm going to grab my functional activity, drop it in front of each of those. All right, so I've got essentially a couple activities pulled from the professional guidelines, right? Our profession has determined that this is a globally accepted functional outcome measure with specific activities that have been tested, reviewed, peer reviewed, accepted. So I have 20 opportunities in this document to extract functional goals. Now, your patient might come in and they might be like putting on shoes or socks, 0 difficulty, no problem at all, awesome. Walking 2 blocks, current level of function, moderate difficulty. Okay. Rolling over in bed, current level of function, a 1. So going by this, what I've got is when I come in here, I'm going to look at this and say walking 2 blocks, current level of function, moderate difficulty. So I'm going to drop that in there. Goal level of function. After my initial evaluation and determination, do I believe I can get the patient back to no difficulty? Because the patient told me prior level of function was no difficulty. And I think I can. So walking 2 blocks, goal level of function, no difficulty. You can make the determination in how many weeks and how many sessions this is going to be. But this essentially could be my goal. And then I've got walking between rooms, right? So prior level of function, no difficulty. I believe I'm going to get the patient back to no difficulty. And current level, a little bit of difficulty based on the functional outcome measure response. Rolling it over in bed, it could be the same thing. Maybe we've got moderate difficulty right now. Then we've got no difficulty for my goal level and no difficulty for prior level. So I've got current, prior, goal established right here. And then what I'm going to do is now this is starting to build out my plan of care, right? I want you to understand that. This is building out my plan of care. This can be copied and pasted into an electronic medical record that doesn't allow me to create templates and formats like this. I would literally go through, copy all 20 criteria. I would copy options, current levels for all of those, and then whatever the patient determined, was a deficit, that becomes one of my goals. I've got current, prior, and goal. And if I choose, let's go with a basic guideline. Let's say I have, I'm going to grab full screen here. Let's say I have 8 functional deficits, right? 8 functional deficits. Rolling over in bed, walking 2 blocks, sit to stand without upper extremity assist, ascending, descending stairs, carrying objects from the car to the kitchen. So 8 functional deficits. What does that look like in my treatment note, in my progress note, as my documentation progresses? I like to use the example, think of it like a table of contents. So I open up a book, right? I've got the table of contents. Each one is a chapter. Each chapter has my goal. So if goal number 1, and I usually kind of set them up from easiest to most complex. So if goal number 1 is rolling over in bed, and current level of function is a little bit of difficulty. Goal level of function is no difficulty. That's chapter 1. My first treatment note is based on my goal number 1. So my first treatment note relates to, I taught the patient how to use a log roll technique and trunk abdominal bracing to transition from supine to side lying to sitting at edge of bed, sitting at edge of bed to standing, right? Patient was able to perform with no pain. Patient was able to perform with no limitation or disability, normal speed, sequencing, goal met. That's it. And then my second goal is walking between rooms. And so treatment number 2 is going to address goal number 2. And everything around treatment number 2 is designed to achieve goal number 2 or move toward achieving goal number 2. And then treatment number 3 is addressing goal number 3. Right? So do you see how this is all kind of working in sequence? So if I have 8 goals, I want to lay this out. So the first day is the initial evaluation and initial treatment. For me, I always have a home exercise program on day number 1. Session number 2, we're addressing goal number 1. Session number 3, we're addressing goal number 2. Session number 4, we're addressing goal number 3. Okay? Session number 5, we're addressing goal number 4. So at this point, I've had 5 sessions in the plan of care. I've addressed 4 goals. Then I've got session number 6, goal number 5. Session number 7, number 8, number 9. By session number 9, I've addressed all 8 goals. Session number 10, if it gets to that, my progress report is complete because I've addressed all of my goals. I've measured progress toward the goal. Session number 10 is when the progress report would be due at the latest point. but I've already addressed all of those functional goals. I've taken those functional goals from professionally established functional outcome measures that are universally accepted as the standard of care. Now, you might be saying, but Tony, my patient has, personal goals that aren't listed there. You can have additional goals. You can have other things. Most patients aren't coming simply to get better at rolling over in bed. So I don't want you to confuse the patient-centric goal with the payer-centric goal. This is about meeting Medicare and other third-party payer guidelines first. Then you can add what the patient requires second. So, this just kind of gives you a little bit of a framework, right? If we have a framework to work from, we can improve the system, we can improve the efficiency. And so if I've already been provided with accepted functional outcome measures that the profession has said, this is what we want, that's what I'm going to go with. Don't get creative when you're looking at your documentation for third-party payers. They're telling you what they want, satisfy what they want. If you want to provide more than what they're asking for, that's your choice. You're the business owner, you're the providing clinician. But at the minimum, provide what the payer is asking for. Too often I see therapists provide way more than what's minimally required, but they forget and they miss the small technical parts. So guys, I hope this gives you some guidelines. I hope this gives you kind of a little push, a little nudge to work on your systems to create a business that's sustainable, that will continue on. If you have questions, let me know. Post the questions in the YouTube comments, like the video, subscribe to the channel if you haven't. And if you want more useful content like that, just let me know. I'll catch you next time.